Thank you, Dr. Binti. Assalamualaikum and good morning, everyone. So for the second session today, we are privileged to hear from someone whose expertise and insight have made a significant impact in nursing. So please join me in welcoming our esteemed speaker, Professor Emeritus Dr. Lian-Hua Huang from National Taiwan University. So Professor Emeritus Dr. Lian-Hua is the third Vice President of International Council of Nurses with extensive experience in nursing education, practice, and research. So in today's session, Professor Emeritus Dr. Lian-Hua will be sharing her thoughts on the topic about our nurses, our future, caring for nurses, strengthen economies, a subject that is both timely and deeply relevant to our community. We are confident that this presentation will leave us not only informed but also inspired. So without further ado, please join me in giving a warm welcome to Professor Emeritus Dr. Lian-Hua. Thank you.
Thank you for your nice introduction. Happy International Nurses Day. Good morning. It's my great pleasure to be invited as a guest speaker today. And I will base my talk on the Aziyan 2025 International Nurses Day report. To celebrate International Nurses Day, we need to have a global view. Continuing our overarching theme, our nurses, our future in 2023, Aziyan has chosen to focus IND 2024 on the economic power of care and to focus IND 2025 on caring for nurses, strengthen economies. First, I want to talk about nurses' unmet needs and unacknowledged struggles. The global nursing workforce is in the midst of an unprecedented crisis, one that has profound implications for public health system, economies, and the future of healthcare. Nurses essential to healthcare delivery are increasingly facing insurmountable challenges that undermine their well-being and threaten their ability to provide high-quality care. Current workforce challenge is severe. Chronic understaffing, unsafe working conditions, and inadequate pay have led to widespread burnout, high attrition rate, and the migration of scarce skilled professionals to countries with less damaging work environment. These factors combine with escalating demand for healthcare services driven by aging population and growing non-communicable disease have created a perfect storm that is pushing health system to their limits. The global health workforce crisis, the shortage of nurses, is pressing global issue, with current estimates suggesting a deficit of 5.9 million nurses. Despite awareness of this crisis, many countries rely on short-term solutions like international recruitment and task shifting to less skilled workers, which fail to address the root causes of nurses retention and recruitment. Aziyan proposed the Caring for Nurses agenda, which identify and integrate 7 critical areas. Well-coordinated action can transform healthcare workplace and protect the nursing workforce for the good and health of all. First, ensure adequate staffing and skill mix for effective care. Implement evidence-based workforce plan and balanced skill mix to ensure safe staffing level and sustained workload. continuously monitor workload, and proactively address staffing gaps to minimize risk and prevent nurses from being overstretched. Second, invest in right resources and equipment. Provide nurses with the essential resources, equipment, technology, and infrastructure required for safe and effective care delivery. Ensure the timely update and optimal functionality of medical equipment while maintaining a steady supply of care materials that adhere to quality standards. Furthermore, prioritize investment in digital tools to drive productivity, improvement, and optimize care delivery efficiency. Third, provide safe and decent working conditions. Uphold nurses' right to safe, healthy working environment. Implement robust safety protocols and ensure personal protective equipment, ergonomic tools, and protected rest period to prevent occupational hazard and fatigue. Decent working condition means ensuring that every nurse has dignity, respect, rights, and a healthy work-life balance. Fourth, support education, professional development, and optimal scope of practice. Prioritize investment in high-quality nursing education and continuous professional development that equip nurses with the skill required to meet evolving healthcare demand. Empower nurses to work to their full scope of practice by modernized policies and regulation to enable advanced practitioner role. Provide clearly defined career pathway and ongoing professional development opportunities and ensure nurses' expertise is valued. Fifth, building supportive, high-performing organizational culture. Cultivate a culture of excellence that prioritizes people-centered care and continuous improvement. Foster inclusive, collaborative, and transparent environment with strong mentoring program, and enable nurses as leaders and decision makers. 6, ensuring access to healthcare and well-being support. Remove barrier to healthcare access for nurses by streamlining pathway to ensure easy, timely access to preventive care, treatment, and support services. Ensure these services are readily available and designed to meet nurses' unique needs. 7, value nurses with fair competitive compensation. Provide salaries and benefits that reflect nurses' expertise, responsibility, and dedication to patient care. Address pay equity and ensure fair workload distribution. Support flexible working arrangement to accommodate diverse needs and increase workforce retention and job satisfaction. Aziyan President Cipriano stressed the caring for nurses agenda is another set of action that move nurses from being invisible to invariable. Over the past several years, Aziyan have laid out the evidence and steps to support investing in nursing and nurses for a sustainable workforce and stronger health systems. Integral to sustain our workforce is investing in their well-being. We cannot and would not want to envision a world without nurses. We must take actions to diminish the threat of safe, supportive, and healthy working conditions that will attract future nurses and retain the dedicated nurses who are key to healthy communities, responsive societies, thriving economies, and powerful nations. The return on investment from caring for nurses brings better patient care. Investment in workforce well-being not only improve employee retention, but also enhance motivation and job satisfaction, leading to better patient outcome and lower turnover rate. This creates a positive cycle for higher productivity, more satisfied staff, and ultimately better care for patients. The social and economic impact for failing to care for nurses, we must urgently address this structural failure to value, protect, and care for nurses in order to both recruit and retain a sustainable workforce. Failure to act now will have profound consequences, not just for healthcare, but for national economies as well. Short-term fixes such as increasing international recruitment, shifting tasks to unregulated and less skilled workers, and increasing reliance on casual workers. Government must act now, not only to recruit, but also to properly educate and retain the workforce of the future. Prioritizing health to drive productivity in healthcare, defining and implement policies to ensure a well-staffed, well-distributed, well-supported nursing workforce is critical. Yet, globally, there are concerning policy gaps and challenges with implementation. Aziyan's 2025 survey of NNA president found out that the majority of countries lack comprehensive strategy to share workforce distribution that meets the care needs of regional, rural, and remote communities. A majority also did not have policy to ensure safe staffing level or an adequate mix of skill. Short-term fix and long-term solutions are needed. Building a healthier future, a holistic approach to nurses' well-being is needed. Achieving this vision will require coordinated actions. We now need to move away from fragmented ad hoc responses and take decisive action to prioritize nurses' well-being and build and sustain a strong nursing workforce. Aziyan's 2023 Charter for Change established a fundamental framework for protecting the well-being and sustainability of the world's nursing workforce and health system. The Caring for Nurses agenda proposed this year operationalized key strategy and policy action laid out in the Charter for Change, with a focus on caring for nurses' health and well-being as a crucial driver for improving nurses' nursing workforce productivity and retention, and ultimately population system health. The Charter for Change was proposed by Aziyan in 2023. There are 10 of them. First, protect and invest in the nursing profession. Second, ensure safe and healthy working conditions and respect nurses' rights. Third, recruit and retain nurses by ensuring fair and decent pay and positive practice environment. Fourth, develop, implement, and finance national nursing workforce plan. Fifth, invest in high-quality accredited nursing education program. Six, enable nurses to work to their full scope of nursing practice. Seventh, recognize and value nurses' skill, knowledge, attribute, and expertise. 8, engage National Nursing Association as professional partners. 9, protect vulnerable populations, uphold and respect human rights, gender equity, and social justice. 10, appoint nurse leaders to executive positions. A global call to action. Aziyan's Caring for Nurses agenda for a sustainable workforce well-being. The Caring for Nurses agenda is a comprehensive, actionable model designed to promote the health and wellness of nurses as essential for the sustainability and effectiveness of healthcare system. It takes a whole-of-system approach that emphasizes the need for collaborative action at multiple levels. At the organizational level, healthcare provider, managers, and leaders must create environments that support nurses. At the national level, government and health policy makers should adopt policy that safeguard nurses' health. At the international level, health systems must collaborate to ensure the health for all nurses and populations. And global health organizations should set standards and advocate for policies that protect and promote nurses' well-being. Next, I will show you the data from the state of the world's nursing. This is the density of nurses, number of nurses per 10,000 population in 2020 in the Western Pacific area, from the highest to the lowest. You can see Taiwan is 73.9, Malaysia is 34. The State of the World's Nursing 2025 just released on May 12th, 2 days ago. Please look up for the most updated data. If we look at OECD countries, they hire a lot of foreign trained nurses like Ireland, New Zealand, Switzerland, Australia, and UK. The biggest source countries are Philippines and India. Salary data is presented in Purchasing Power Parity, PPP, as defined by the International Monetary Fund. And this standardization facilitates an international comparisons. This slide shows the starting salary for the clinical nurse in public hospital in Asia countries. You can see Macau is the highest, followed by Singapore, Taiwan, Japan. Nurses are essential in transforming healthcare and health systems such that no person is left behind without access to care or impoverished because of their needs for healthcare. This is the goal of health resources for health, human resources for health by 2030. It's time for action. Let us seize the opportunity to commit a decade of action that begins with investing in nursing education, jobs, and leadership. Participating policy making is very important for nurses. The future development of nursing profession requires strong nursing leadership, governance, and sustainable investment. We need to sit at policy table and participate in policy making, ensuring nurses' voice be heard, and influencing nursing and health policies. Nurses must be a part of high-level decision-making. Now, I would like to give you an example that how we increased nurses' pay successfully in 2011. There was severe national nursing shortage in Taiwan in 2011. Compared to OT, PT, RT, ST, nurses were paid less, $100 per month. In March 2012, I, as the director of nursing, get the same pay as medical personnel with BS degree, and we finally increasing nurses' pay successfully. Everybody increased $100 per month. Therefore, for new nurse, the starting salary is $1,534 monthly. And I can share with you in 2025 at National Taiwan University Hospital, we have 97.84% nurses with BS degree. We turn crisis into opportunities. A tempest of increasing pay for nurses was resolved, and an average of 11% increase in pay for nurses nationwide. The nursing shortage problem was solved dramatically. Right now, Taiwan is facing another wave of nursing shortage, and we need to work to solve the nursing shortage problem. In conclusion, as we face growing healthcare challenges from aging population and rising chronic disease to climate-related emergency and deepen global inequalities, the need for a strong, sustainable nursing workforce has never been greater. The time has come to move beyond short-term fixes, fragmented initiatives, and approaches focused solely on individual resilience. We must build healthcare environment where nurses can thrive, not just survive. This is the board of Aziyan for 2021 to 2025. Well, I serve as the third vice president. It is time to make nursing from invisible to invaluable. Hope to see you in person next month in Helsinki Aziyan Congress. Thank you for your attention.
Thank you very much, Professor Emeritus Dr. Lian-Hua Huang, for such a thought-provoking and inspiring presentation. So your words have not only shed light on the critical role of nurses in shaping the future of healthcare, but also reminded us how caring for our caregivers is a vital investment in stronger, healthier economies. Your passion, expertise, and clarity have truly left us with much to reflect on and act upon. To our wonderful audience, thank you for your attention, your present today. So your engagement showed a shared commitment to advancing the dialogue and driving meaningful change in how we support our nursing workforce. So let today's session not just be the end of a discussion, but the beginning of continued advocacy, action, and collaboration. Once again, thank you for all being here, and thank you, Professor Dr. Lian-Hua Huang, for sharing your time and wisdom with us. So wishing everyone a pleasant day ahead and happy Nurses Day. Thank you.